Okay, hi, it's Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. We're looking here at the biceps tendon in just a second. We'll show you that. We're going to pull this dry dock back. There's the biceps tendon. It actually doesn't look too bad. And as we push on the biceps anchor a little bit, although it peels away a little bit, I don't think that's abnormal at this point, given the rest of what's going on in the shoulder. So we're going to look down the front of the shoulder in just a second here. All right, so as we look down the front, you can see there's a lot of redness in the joint capsule, but the labrum here looks okay. As we look towards the back of the shoulder, very similar picture, almost like a adhesive capsulitis or frozen shoulder looking capsule, but you didn't have that. And as we look to the right, we're going to see this large rotator cuff tear in just a minute here. So the rotator cuff is actually, that's it right there. It's medially retracted quite a bit, basically past the level of the glenoid. And so whatever's left of the cuff is going to be down here. And here we can see where the insertion is torn right there, and this cuff is kind of split. So we're going to go off on the video, reposition your shoulder in a minute. We'll come back up on the video after that. How do I get that picture on the left to go away? Okay, so we're just looking in the subacromial space. You can see coming in from the right side of the screen, which is posterior, this is our device that allows us to remove some soft tissue. It's got suction attached to it, and we can also control any bleeding with it. And so we can see the hole here. That's the biceps tendon right at the tip of that instrument. This blue cannula is coming in the front of the shoulder. And now we're going to do just a limited decompression of the anterior and lateral acromion. It doesn't look like you have too much of a spur, so that's good news. And there you can see the tear. Normally the tendon should be inserting into the bone all along here. So we're going to have to make a little space for that. And we're going to put that back down where it tore away from. So we'll show you some more in just a little bit. I'm going to hold it down. Okay, so this is the tear. It's bigger than it looks because when we lift up the cuff, you can see it doesn't really insert until we get way back there. So we're going to try and, I'm going to have you come down here and rotate. We're going to have to rotate the shoulder, and I don't want to really take down any more cuff than I have to, but I do want to get an anchor, internally rotate like that. I do want to get an anchor down posterior. Okay, come back to normal, to neutral. Okay, so we'll get to work here. We'll show you some more in a little bit. Spinal. Okay, so we've got our first anchor. I just want to show you how we were able to get this thing pretty far posterior, so much so that the sutures are kind of draped over the cuff, which is actually what I wanted. We're going to take out one of the black and white striped sutures out anteriorly there. We're going to come in with a straight suture hook way back here. which is going to give us a real good hold on the infraspinatus or posterior portion of the tear, straight one. Grasper in the front. But I just want to show you our setup here. There's our grasper. Okay, so here's what the suture hook looks like. It's loaded with a black wire called a super shuttle, and this is basically the smallest way to pass suture through the tendon. We're going to start, see how we're starting way back here. I'm going to hold the camera right there. We're going to use this to help us even. Let me get a little better look back here. So we want to start way back here. We're going to go down. There you can see it's just poking through there. We'll push the relay through and make sure we like that provisional. Yeah, I like that. That's going to be good. So hold that right there. We'll show you some more in just a minute. Okay, so here's the first mattress stitch. We're doing a mattress stitch because you still have a lot of tissue over the tuberosity in the back. But that's what we're going to tie down. That's going to give us our initial anchor point right there. And I like the way that looks. We'll show you some more in just a minute. No. Okay, so what we've got done here is that first posterior suture we showed you, which is right back in this region. And then we just did one side-to-side suture right at the apex of the tear. And that knot is somewhere right in there. Okay, and so we're making good progress. It's starting to come together. We've still got two more sutures from the first anchor. There they are. And next we're going to tie one of those. Grasper. Okay, so we're going to do another side-to-side stitch. We've now passed two posterior mattress sutures and one side-to-side at the apex, and you can see what we're getting ready to do here. We're going to try and close this all the way over like that. So there you can, in just a minute you'll see it poke through. I just want to rehearse the stitch there just like that. Okay. And then on this side, we want to get this tissue, not the biceps, but this tissue here. And I think that will be enough. Okay, I'll show you some more in a minute. Okay, so let me show you where we're at. We have now stitched this all back together. We haven't tied all the sutures yet, but it's all stitched back together. We've ended up placing 3 side-to-side sutures. You can just catch a glimpse of the side-to-sides. The black and white suture is one of the side-to-sides. There's another one down there, and there's one more at the apex. We've passed another second suture anchor, and the anterior suture from that's going out over the biceps to close down the interval a little bit, back to an anatomic position. We've got the second suture from the second anchor also functioning as a side-to-side, and then we've got the third suture from the second anchor. That's that blue one, and that's going to hold down this posterior aspect. So before we tie that, remember we've still got our third suture from the first anchor, and that's this blue and white striped one. We're going to push in the cannula there. We're going to pass or retrieve this suture and its partner. So we want this one. Just tug on that for a minute so I can find it. And then there's the partner right there, so we're going to get this. And we're going to tie that next. So once we have these all tied, we'll show you the final result. Okay, so we've got everything tied. You can see that, actually it's what you can't see anymore that's most significant. We can't see the biceps tendon anymore. We can't see down into the joint because that rotator cuff's completely repaired. We're just giving you a little bit better image here and making sure there's nothing that we need to stop the bleeding, nothing we need to cauterize. And so as we look here, that looks pretty good. That's our second suture anchor. The first one, remember, we tied a couple mattress sutures way in the back and preserved as much of the native rotator cuff tissue as possible. Okay, now we're getting a pretty good look at what we did in the back here. That's way in the back. There's our mattress sutures starting here to hold that down. And then we get to the front where we start to do some interrupted sutures. So all in all, very happy with the way this came together. We're going to get you back to the recovery room shortly. I'm going to rotate the humeral head here. The one last thing we're going to do is we're going to make some little bone vents. If we have the punch for it, I'm sure we do. I can see it right there. So we're going to make some little holes in the bone just to help in the healing process, okay? So good luck to you now. Bye-bye.